And so maybe you can talk a little bit about some of the challenges that you've faced to get to where you are right now and how you overcame them, and maybe inspire some other people too who are getting challenged.
Yeah, I think a few things. One of the things that challenged me, like I mentioned before, you have to relinquish a little bit of control in some way the higher up in training you get, and when you finally become an attending someday, it feels like a long road. You become really not in control at all of many of the minutiae, and I am a perfectionist and type A, and I like to know exactly what is going on with every aspect of my patients. But when you're taking care of the number of patients that we have and carrying the shock pager, as David mentioned, you can't do that. And so you have to learn to let some things go. And so that, I think, took a little bit of time for me to get used to. And like I said, just trusting people, which you find you really can. And the big things you will hear about because the people on your team will bring them to you. And then I think the other thing too, in the ICU, we care for patients more longitudinally. So when a patient doesn't do well or something happens that is disappointing of course, to the patient and the family and to everyone caring for them, it can be really hard. And I think I've carried that home with me quite a bit in circumstances when that's happened. So, and I think it somehow even means more when you finally become the attending. It feels like it's really on your shoulders. So I think learning how to ask for help, to lean on your support system with your colleagues and in your personal life, and to try and learn from it and give yourself some grace, I think that has been a learning curve too.
I would say the two biggest challenges that I've had, and one I still struggle with, the other one not so much, is being in the unit, you'll be there for a week, and like Kelly said, you develop a relationship with families, with patients, with everybody, is leaving the unit and then finding myself at some point back in the unit every day for the following 3 weeks until I'm back on, or checking the list, or checking up on patients remotely, because you feel very responsible, involved. You've been attached to this person. Yeah. You've met the family. You've met and it becomes very exhausting is not the word, but you can imagine that if this is always in the back of your mind, no matter what you're doing, if you're in the OR, you're still thinking about kind of, oh man, what happened to Mr. So-and-so? Or like, oh, I hope, And so I think that's been a challenge, is trying to, in a healthy way, kind of be able to step back and be like, I have, like Kelly said, give up responsibility, and Kelly's going to take great care of this person, and I need to stop. And I think one of the other big things is you can imagine that most people who've gotten to this point in their training are relatively type A people who are used to, as Kelly mentioned, being in control, being right about things, and it's very humbling and can be, even frustrating sometimes to be like, you're wrong, like being told that you're wrong about this, or this is not what we're doing, or, this is why we're doing this other thing. And to feel like at, 32 years old that I still have so much to learn from the surgeons who've been doing this for a long time, for the attendings in the ICU that have been doing this for a long time, even from my students, some of the residents are just infinitely more talented than I am, and I'd be like, and being able to accept that and continue every day to learn from these things. It's great, but it can be, frustrating at sometimes. Because I feel like I put in 20 years of trying to learn this stuff, and I still, there's still so much.
Flashback to the lifelong learning. It actually is.